Hello beautiful people, welcome back to the channel. Today I'll be talking to you about colon cancer or colorectal cancer. This month is ovarian cancer month, but I still took a time to make a video on colon cancer instead of ovarian cancer, as I should. Colon cancer has little to no noticeable signs in the early stages. That means it's pretty dangerous. So I took a liberty of time to make a video on colon cancer. Now I'm going to be telling you warning signs that you notice in the early stages of colon cancer. So please stick with me. The first you would notice is a black stool, blood in the stool, bright red, tarry, or dark stool. You may also notice changes in bowel movements, constipation, diarrhea, just any change you notice. Do not take it for granted. You also notice abdominal pain or cramping, accompanied with reduced appetite and unexplained weight loss. So as time goes on, there are other symptoms that will follow. Such symptoms are feeling of nausea and vomiting. You also notice that you have rectum pain in your rectum or anus. Now I want to say, for my girlies out there, please, because I remember this particular story that this girl was telling me. She was telling me that she thought she had an ectopic pregnancy because she felt cramping in her rectum or anus. So if you're a girl, you may or you may not experience this particular pain in the rectum. This is just contractions just before your period. You know, it has the same innervation, so that's why you feel this contraction. Sometimes before your period, sometimes when you're on your period or you're having cramps, you also feel cramping there. But this is a common symptom of colon or colorectal cancer too. You may also notice difficulty urinating. That's difficulty starting or stopping urine. You also experience weakness or fatigue due to anemia from blood loss. Now, there are advanced symptoms. Symptoms you notice as this cancer advances. The first is severe abdominal pain, like on a pain level from 1 to 10, 9 to 10. Severe abdominal pain. You may also have symptoms like vomiting blood or dark coffee-like material, that color. You may also notice abdominal tenderness. And the last but not the least is bowel obstruction. That's not being able to go to toilet. Now, there are risk factors or factors that predispose you to colon cancer. The first of these risk factors is age. If you're over 50 years of age, then you have prospects of developing colon or colorectal cancer. Also, if you have family history of colon cancer or polyps, you are also a good candidate. Also, if you have personal history of colon cancer, polyps, or bowel inflammatory disease, you may be a good candidate for colon cancer. Also, if you smoke, if you're a smoker, this predisposes you to colon cancer too. If you're obese, if you do not exercise, sedentary lifestyle, or you have a diet that is high in raw meat and processed food, you are a good candidate for colon or colorectal cancer. So there are ways that you can protect yourself, or better still, even if you have this, you can catch this at the early stages. You know what I always say, when you catch it at the early stages, you have better prognosis. The first is getting regular colonoscopies as soon as you hit 50. So even if you have it, you catch it early. The second is taking a fecal occult blood test often too. You can catch it in time too and have good prognosis. That's if you have most of these symptoms I mentioned earlier. You can also prevent this by taking regular flexible sigmoidoscopy screenings. You can also prevent this by engaging in healthy lifestyle, exercising. You can take walks, any form of exercise that you are comfortable with and works well with your schedule. You should also engage in healthy diets rich in fruits, vegetables, and whole grains. Then if you're a smoker, you should quit smoking. Apart from colon or colorectal cancer, smoking exposes you to other types of cancers, like lung cancer, because of the main ingredient in those cigarettes or whatever it is you smoke, which is nicotine. Nicotine does a lot of damage in the body. It is a carcinogen. So you want to quit smoking. And last but not the least, try to maintain a healthy weight, because obesity is a risk factor for colon or colorectal cancer. I hope this video finds you well. I hope it is helpful. Thank you for watching. Please subscribe, like, send to WhatsApp groups, send to your village people. I'll see you in my next one. Bye.